and livelihood outcomes for women and girls in Nigeria. They believe this can be done through addressing the harmful gender norms that create barriers to promoting their health and economic development. This formed discussions at the National Dissemination of a Gender and Social Norms Research Study in Abuja. TVC News' Kemi Balogun reports.
Several factors contribute to and negatively impact the health and livelihoods of women and girls in Nigeria. Without proper methods to reversing the negative trends, many of them do not achieve their full potential in life. As part of efforts to change this narrative, a research study was conducted to highlight not only the challenges they face, but to also design interventions that will be tailored to their specific needs.
This kind of notion that when you uplift a woman, you're certainly taking her to a position where she would now lord over a man or lord over a man and be disrespectful and hope. So the respect is earned. It is not in such a way. What we are advocating for are the independence of women. Women are very much at the lower point of the ladder. So bringing up women to be more financially independent, to be able to cater for the house and also provide financially in the household.
You see certain cases of women-led households because either the men have left or the men have been killed or something, and then the burden of a woman leading the house, now the burden of men leadership of the household has shifted to women. So those peculiarities is what studies like this help us bring out, and it helps us to design better interventions.
The study will be used to address the negative social norms that act as barriers to improved health and livelihood outcomes for women and girls by understanding the shifts in household dynamics as well as the drivers of the challenges in order to create accurate policy framework.
For instance, the impact of the current economic climate and how that has created certain shock on communities, and communities actually have to adjust. And therefore, in that adjustment process, new norms are emerging, and some of those new norms are really positive norms, and therefore the challenge will now be how do you design programs and intervention to sustain these new norms.
This high-level gathering agrees that collaborative strategies for dismantling harmful gender norms that create barriers to promoting health and economic advancement for women and girls need to be addressed. Kemi Balogun, TVC News, Abuja.